In this episode, we will talk about the increased HIV crisis in the Philippines, a rise of nearly 600%, a deepening epidemic and its impact on specifically the gay community, and that affects you even if you are not. But let's talk about the big elephant in the room and not try to save people's feelings. It all comes from that, male to male at some point in a relationship. We'll get to that later. The Philippines is currently facing one of the most severe HIV epidemics in Asia. From 2012 till 2023, daily new HIV infections surged by 411%, escalating from approximately 9 to 46 per day. By the first quarter of the 2025, this number has risen to 57 new cases daily, with 95% of these cases among men. Think of that, 95 cases among men. And those 5% of women, I promise you, had some kind of relationship with the other 95% of men who had relations with the other men. So let's not ignore the fact that this comes from that unholy act of male to male. I don't care if that's what you want, but remember to do it only within two people. It's not right to go on and spread it to women who then come spread it to me. It's ridiculous. Predominantly young individuals aged 15 to 34. This alarming increase is largely driven by the LGBTQ+ community, particularly men with sex with men, MSM, who account for over 70% of the new infections. Let that sink in and don't try to ignore it. Let's not try to save people's feelings or hurt their colorful rainbow. Despite this, more than 3/4 of male-to-male have never undergone HIV testing. That 75% of men who don't even think of this being a problem never get tested or even take the appropriate medication, and we all know some of the reasons we'll get into in a second. Let's take a look at that. Despite this, more than 3/4 of them don't get tested. As I said, the stigma surrounding homosexuality and HIV status deters many from seeking testing and treatment, leading to late diagnosis. Do you know why there's stigma? It's because they should be ashamed. It's not right. Even internally, you know deep within you that it's not right, yet you do it. This deters many from seeking testing and treatment, leading to late diagnosis and higher mortality rates, although morality should be in there. In 2023, nearly 1/3 of the new HIV cases were diagnosed at advanced stages, contributing to 1,700 AIDS-related deaths. That's a lot of people from AIDS. The government's response has been insufficient, of course. Why would they care? They want to pocket all the money. Any kind of funding that goes to these clinics goes straightly to the politician's pocket. The government's response has been insufficient. Comprehensive education exacerbating the crisis. Despite the availability of the free HIV testing and pre-exposure prophylaxis PrEP, only 13% of key populations are aware of these services. The LGBTQ+ community continues to suffer not only from the physical toll and the epidemic, but also from societal rejection and discrimination. This intersection of health and social stigma creates there needs to be social stigma. I do not understand why they keep forcing you to try to pretend this is okay. It's not. There's nothing okay about it. That is why there's a stigma. We all know deep within our souls that male to male should not be doing this, especially spreading it to other people. If you have someone you love, apparently, then why go and spread this? Those two should never be going outside that relationship if they absolutely have to do this. Impact of foreigners and dating dynamics also is important to remember. The escalating HIV crisis in the Philippines has profound implications for foreigners, particularly expatriates, those are expats and tourists, navigating the local dating scene. The surge in HIV cases introduces complexities for foreign nationals seeking relationships. Of course, the health risk and awareness. Foreigners engaging in intimate relationships may face health risks if they are unaware of the local HIV prevalence and preventative measures. The stigma surrounding HIV can deter individuals from seeking testing or disclosing their status, increasing the potential of transmission. Of course, who would want to do it with someone that tells you they have HIV? Nobody. Well, I mean, there are some people, some sick fucks, some very, very desperate men, but many people will not be doing anything with someone that has HIV. Cultural sensitivity and communication. Understanding the culture context is crucial In a predominantly Catholic society, discussions about sexual health and HIV are often taboo. Foreigners may find it challenging to communicate openly about this, leading to misunderstandings and potential health risks. Of course, legal and medical access as well. Accessing healthcare services can be daunting for foreigners due to language barriers. Unfortunately, the healthcare system and the potential legal restrictions won't allow some to go ahead and seek help. This can delay diagnosis, of course, and treatment. The reality is, this is not a good combination of desperate women meeting desperate men. The women are in search of money, so they sleep with as many men as possible, which makes them easy. You, as a new foreigner coming in, the first thing you do is get with the easiest woman, the same woman that had hundreds of other partners. When I say hundreds, I mean hundreds, because I personally have easily over 100 without ever paying a single dollar. And by a dollar, I don't mean buying them Jollibee, I mean actually paying for the service. Never have I done that, although I've paid for taxi fares, food, or other things. I've never once directly paid someone for the exchange. So if I've done that with over 100, can you imagine people that pay for it? $20, $30 for the same girl. And once you see them often, of course, you can reduce the price, even $10. Some easy as 20. Imagine how many women can one person have? And those same girls that go around the bars that you are frequenting thinking somehow you met the one, the diamond in the rough. No, believe me, these women, they know what they're doing, and this is the exact result. This is proof of what I'm telling you. Yes, of course, over 70% are men, or 95%, I should say, are men, but those 5% of women is still a large number, because those 95% men can easily still pass it to new women that have not been tested. These are the ones that only have been tested. There could be 10s, if not 20 times more women out there that have it without you even knowing. So before you get all carried away, excited in paradise, remember to either wrap it up or start seeing somebody regularly and have them tested. Even then, they cannot be trusted because you know they will cheat when you're not with them. So thinking that you got a test 3 months ago does not mean 100% you are safe. That is why it's crucial to pick someone you trust and live with them. Believe me when I tell you this is not a joke. It's a very easily catchable. This is not middle school trying to scare you away from having intercourse. I'm just telling you the stats. And don't tell me you haven't caught it. You are a single person. You do not speak for the majority of expats. You have been lucky so far. It only takes one time. That's it. You can bang 100 women, not get anything. But the 100th can be the one that ruins your life. It's fun. Sure, do it. Wrap it up. That's all I'm telling you. You can do whatever you want, but keep this in mind that you've been warned. And it just takes one bad decision to put you in a position you never ever expected to be in. Places like Cebu and Angeles City, and of course the Metro Manila area, have the most women that have this type of sickness. Most of them are men. This is another reality of why there are so many men out there dressed as women, pretending to be women, trans, ladyboy, whatever you want to call them, baklas, and so on, because it's money. Simple as that. They sleep with men that have no standards, no morals, and are basically at the last quarter of their life. So they do whatever they want, thinking this is it, this is their only chance to be happy and try to fill that big hole in their soul that will never be filled by another person's meat. Remember, do what you want in this country if you have to come here. Live your life. Meet someone that actually can be next to you, by your side, support you. Then you can go ahead and support her the way you need to be doing. That's fine. I'm talking about just spending money on scammers and running through the same woman that we're all running through. I can't imagine the amount of times I've seen the same woman with different men. It's unbelievable how low some people go. This is a reality check for you. Don't forget, your life matters. You should not waste it in the Philippines.